Welcome, Brett. Thanks for taking your time out of your day to answer a few questions for our Intro to PT class. How are you doing today?
Oh, real good. Real
Awesome.
good.
Well, let's jump right into it. First, I'd like to start by asking you to give us a little bit of a history and insight into what happened to you, your incident, whatever you want to call it. And this will kind of lead us to discussing your disease or your health condition.
Yeah, okay. Well, yeah, it was about 7 weeks ago. I was out riding my bike, and towards the end of it was a road bike, and towards the end of the ride, I just made a kind of a weird turn and ran off the pavement of a concrete bike trail, and for some reason just didn't steer right and tried to get back on and caught my front wheel. I fell over straight over on my left hip onto the concrete. Didn't stick my foot out to catch me, so I landed right on the left hip, the greater trochanter, and fractured right through the trochanter, a complete fracture with some displacement through the entire femur, so at the hip, basically kind of at the joint of the hip. And so, needless to say, I suddenly couldn't do anything. I had some really nice people help me. A couple of ER docs were right there within a minute or so, walking on the trail with their children. They helped me and called 911, and then got lots of help. Got carted off to the hospital. ER, and then was admitted because I was going to have surgery to help fix my hip.
Yeah. So what did you experience first? What were you feeling when it first happened? Did you know something terrible had happened?
Yeah, I've fallen like that before, and just you get up and you're like, oh, I bruised myself or something. But as soon as I fell off, I just knew something bad happened, and I really was just suddenly immobilized. I couldn't move, almost no movement. I was just on my back, and I couldn't lift, my hip. It was very, very painful. And you don't realize all the muscles. If you try to flex your trunk, try to lift your trunk up, your hip flexors are attached to your hip. That was just agonizing. So you really couldn't move hardly at all. I was just totally dependent on people lifting and moving me. Had that happened out in the wilderness somewhere, I would have just laid there until help would have come, which is kind of a scary thought. You don't realize how vulnerable you are with some kind of an injury like this, I guess. I didn't, at least.
Pretty lucky with where and how it occurred.
Yeah, I was very, very fortunate. Lots of people helped me, and just very, very fortunate that happened that way. It was.
Yeah, and before we start to jump into what your current level of function is, mobility, strength, all that, tell us a little bit about your prior level, because as PTs, we really look at what your prior level is to get you back to kind of that baseline. So give us a little insight into your hobbies, work activities, social life.
Yeah, I was very active, and now I sort of look back on it nostalgically and hoping I can get there. I had walked... I used to love to run, but I started getting a lot of arthritis problems, so I've kind of had to scale that back. But I walked a lot. I've walked, I think, over 30 half marathons in the last 5 years. I like to ride my bike. I would probably ride 10 to 25 miles, not every day, but just maybe once or twice a week, something like that. Very active at home, mowing the yard, and I love to work on stuff, love to work on my house. I love to work on cars, just any kind of like hands-on maintenance type stuff I've always really enjoyed. Really almost no limitations. I could get up and down 100 times off the ground underneath a car. I was up on my roof a couple of weeks ago. I actually used fall protection, but I was up there walking around doing stuff to my roof and to my chimney and climbing up ladders up and down like 20 times probably. So I have been very, very fortunate that I've been able to be very physically functional with almost no limitations. Some arthritis limitations in my hips and knees, but nothing that ever really stopped me too much. Probably walked 2 to 4 miles a day pretty much consistently. Walked up steps, no problem, never had any trouble with that.
So very high level functioning,
very high
level,
independent. As high as you could probably get, unless I was
Exactly.
a marathon runner. I'm not that. Yeah.
So back to kind of the injury and what happened after that. Tell us a little bit about those immediate days following your accident when you got admitted to the hospital and you were waiting for surgery. What were you feeling? What were your symptoms? Just give us a little insight into basically going from that high level of function to being bedridden for a couple days.
Yeah, really, it was really eye-opening and just humbling. To realize how vulnerable you can be. I know they typically like to do surgery ASAP after an injury like that, but I was lucky enough, or unlucky enough, when I was admitted that they had a lot of traumas those days. So there was actually people in front of me with the same or worse types of injuries. So I came into the hospital on a Sunday and I didn't have surgery till Tuesday, and not to complain at all. I was well taken care of the whole time. But you have to go NPO before surgery, and each day they thought I was going to have surgery, but it fell through just because of timing and scheduling. So you'd have to be NPO, and then they say, oh, well, now you don't have to have surgery, so then you'd maybe be able to get a meal. I actually lost about almost 10 pounds during the time, which was good, but
not the way you want to have
not
to
the
lose
way
weight.
you want to do it. But yeah, just like I said, surprising how incapacitated you are with a broken hip. I don't think I ever realized, how many muscles attached to your hip, and when it is fractured, that instability, the pain is truly agonizing. If you even try to lift your hip, flex your trunk, I couldn't get in and out of bed at all. I couldn't roll over on my side. Basically, I was just almost totally immobilized. I was really happy the bed had power controls to raise and lower me, but really, it was surprising how really immobile I was. Yeah.
Mm-hmm. And what was the surgical approach and procedure they performed on you?
It was a hip. I haven't read the operative report to really tell you all the exact, but it was I think a compression screw is what they called it, and it goes in through it's a very large kind of metal screw that goes in through. Basically, it looked like it went right through either up high on the lateral femur or even through the trochanter, and then up into the neck of the femur, almost to the head, or actually into the head of the femur, and then it exits out the side of the femur and then runs exterior down your femur a little ways, and then there's looked like two big screws that pretty much are screwed all the way through the femur in two spots to stabilize that.
Sure, and that's called an ORIF, an
Yeah.
open reduction internal fixation.
Thank you.
Type
Yes.
of technique. Yep.
Yes, that's right.
Pretty common for those kind of traumatic incidents.
Yeah, and I think I've seen X-ray. There's different pieces of hardware they use on different ones. I don't know why, but on mine, that's what they use, a compression screw. Yeah.
Yeah. So it was 2 days after the incident occurred. The incident occurred on Sunday morning, and it was Tuesday.
Yeah, Tuesday mornings when I had surgery, real early, like
Finally
5
had
in the
surgery.
morning.
Yep.
Yeah.
So laying in that bed all day for a couple days, not having a meal, thinking you're going to have surgery, and then you finally get to eat when you get kind of scratched from the book.
You end up
over
skipping
and
a few
over again,
meals,
yeah.
which didn't hurt me any. But.
You didn't develop any pressure sores or bed soreness?
No, my back did kind of itch a lot, I remember, because it just was on my back continuously. Some other things, I hadn't taken a shower the day I rode my bike. I was getting ready to, and man, it was just like I felt so nasty. And they could do bed type baths, but you don't really get completely clean. And so that was kind of miserable a little bit. You just didn't feel like you were clean at all. But yeah, just I noticed my back would itch a lot. It was kind of uncomfortable. No bed sores or anything like that. My skin did pretty well. I noticed my neck. I had a lot of neck pain laying there. I don't know why, and I've had a history of neck pain for 20 years, 30 years. But for some reason, laying there, I had tremendous amounts of neck pain, and I think they had me on quite a bit of medication, and that did help.
What were some of the instructions from your surgeon? Excuse me. Any weight-bearing precautions or other safety concerns?
No, really full weight bearing immediately post-surgery, which I assume was advantage of what they used, And really, no restrictions, no precautions. It said just do whatever you want. And obviously, pain was your guide. And they went ahead and put me on high dose vitamin D because I did have a deficiency of vitamin D, which I was surprised by. And then they put you on a high dose of calcium every day. So those are probably the main two things. Then I had some pain meds that I started taking, and Tylenol, that sort of thing.
So maybe a little suspicious of some deteriorating bone, which maybe played a role in how the fracture occurred?
Yeah, at least on X-ray there was no osteoporosis, but they just, lab tests showed low vitamin D count or whatever, and so they wanted to get that back up because it would be helpful. So yeah, I took a lot of vitamin D through, and I still am. Yeah.
Okay. Tell us about your recovery in the hospital after the day you woke up. Did you get up with physical therapy or occupational therapy?
Yeah, had the surgery in the morning. PT came in, OT and PT came in. I think it was in the afternoon. Basically talked to me about bed mobility, and I had a block on my left, I guess, quadriceps, some kind of a pain block. So the quad was really shot. It was really paralyzed from that. And so they maybe put an immobilizer on my knee so it wouldn't buckle when I tried to walk. And that actually was pretty uncomfortable for the hip, I'm telling you, because you couldn't bend your knee. So basically it transferred all the stress into your sore hip. And so, but we did try to walk with a walker, and I probably walked, 10 or 15 feet, I think, that day. Worked on bed mobility, which was terribly difficult, I thought. Very painful to get my hip in and out of the bed. Walking was easy compared to that. And then I stayed that night, got some nice dinner and breakfast the next morning, and then walked again with PT down the hall and back. Did real good, used the rolling walker. OT came in that day and talked to me and she got me a sock, a thing that puts on your sock.
Sock aid.
A sock aid. A really handy kind of stiff, long, I don't know if you call it metal, not really metal, but it's a long thing with a loop that allowed you to lift your feet up, and that thing was awesome. Yeah. That thing helped me almost as much as anything I had.
And that would help you clear your foot up in and out of the bed.
Yeah,
right?
That was huge. That really helped the first few days. And then they got me reachers, which I used a ton. I love those reachers. I got one reacher. And like I said, like we talked about earlier, I did not get a stool extender, and I probably should have, because I'm so tall and the toilets are pretty low in a lot of houses. And so the first day I had to go to the bathroom, bowel movement seated, and it was pretty tough because just that low sitting position, and it's just really difficult to get up. As soon as I was as tall as I am, if I'm up past 90 degrees of hip flexion, I can get up a lot easier. But if you're pretty low, it gets a lot harder right after surgery. I found that. They would use my arms a lot, so that was good.
Yeah. Looking back, what was the most difficult part of being in the hospital for you?
I think just, there was a little fear of pain. I think, prior to surgery, I never really had any major surgery like that. So I was fearful maybe of how painful it would be, and it was. You're a little fearful that something catastrophic could go wrong, but I was probably more afraid of pain, and that was probably the main thing. Other than that, I think my blood pressure was really, really high prior to surgery. It was like going through the roof. And I do have hypertension, control my medication, and as soon as I had the surgery, it started dropping dramatically. So there was obviously some anxiety there that was evident.
Sure.
Yeah.
Were there any psychological concerns that presented that you didn't expect, and maybe you just kind of hit on that?
Yeah, just that fear. There's fear there, the unknown maybe, or you've not ever had surgery, the fear of how much it's gonna hurt, afterwards. That probably was my main concern. Just, I guess I'm, just fear pain, I guess. I don't know.
So tell us about your discharge home, what the experience was like getting back into your own house, which is probably a big step.
Yeah, we went home the next day, which probably was pretty fast, but that's okay. They wanted to get us out of the hospital, and that was fine. Getting out of the car was just trying to bend my left leg, left knee and hip enough to get in the car was extremely painful. But we got home. Getting out also was difficult. Walking with a walker wasn't that bad. I do have a lot of tile floors in my house, and the walker had reels on the front, but it had plastic inserts on the back legs, which actually were very slippery on my tile floor. And I really wanted to try to get some crutch tips for the back of that walker, but I was really unable to get any that fit that. But it needed to have something that was a little more sticky. I would have been better off with just a walker with 4 crutch tips on the bottom due to my floors. I had really slick floors. So I transferred pretty quick to crutches because they were much more helpful in my home environment. And they really didn't seem like they were that much harder to use for me than the walker. So within a day or two, I was using 2 crutches.
Yeah. What were some of the challenges that you noticed pretty quickly at home?
I have stairs. I've got 2 sets of about 6 stairs. So that definitely was a challenge. Like the first, I don't think I even went up in maybe the first day or couple of days, and I was able to just stay downstairs. I had a big recliner, which was fantastically comfortable with power recline. It was awesome. And I laid in that a lot for the first couple of days. And it just was really comfortable on my hip because it allowed some hip flexion and knee flexion while I was reclined. And so it was probably the most comfortable position I could get in anywhere. But the stairs, and then I did get a toilet seat the second day, and that was immensely helpful. That added like 5 inches to the height of my toilet. It also added handles so that I could push off, which was a real problem. I didn't have any kind of bars or grass, assists in the house. I mean, our house was not accessible, so that was another issue. Sometimes I couldn't push on things like I needed to, but pretty much I could. Did a shower the second day, or maybe the first day I was home. Did a shower, and actually I was a little nervous about it, so I just took my walker into the shower, and it fit in there, and that way I could hold on to it. And that actually was pretty nice because it just made me more secure. And then as days went on, my wife, I had help going up and down steps to begin with, but soon was feeling very comfortable on steps and could negotiate them independently pretty quickly. Within a day or two, I was able to get up and down because I really practiced on that. So once I could do that, that was really helpful. And then I started using a shower upstairs, which was like a tub. And the only difficulty was getting my left leg over the probably, maybe 14-inch threshold of the tub, a little bit higher. And I had a lot of trouble with knee flexion, getting my leg and hip flexion actively. So the first few times I just had to help lift it with my hands. I learned to lift my leg with my hands a lot. And then at first I took my crutches in the shower as well, just for stability. And after a couple times I didn't need them. I was able to just kind of stabilize myself. And my balance is still really good. I'm very fortunate that I've got great balance, so that wasn't a problem at all. Yeah.
Yeah. And speaking of balance, that's typically one of the impairments that we can see after an injury like this. What are some of your other impairments that you've noticed?
Mainly just soreness with moving the hip, the left lower extremity, especially hip flexion. Lifting my leg in bed, that took a month before I could even do that. I was assisting with my other leg, especially getting out of the bed. I just had active hip flexion was just extremely painful, especially at first. And I would say that hurt as much as anything, and was difficult. I'm trying to think what else.
How about strength?
Strength. It's hard to say if it was weak or if it was painful.
Yeah.
When it hurts, for me, when I have pain, it just shuts off. I just can't move it. So, definitely, in my opinion, it was the pain that was the problem. And it's gotten, gradually better through my recovery, thank goodness. And so now I don't have near as much, some soreness, but not near as much, and I can do a lot more because it just doesn't hurt as much. Yeah.
Sure. And I would assume, based on our discussion, range of motion is limiting.
Yeah, range of motion definitely. What was really interesting, and I guess because of the plate that's in the femur, I lost a lot of knee flexion at first, which was surprising. They also used, they told me I learned this on the second visit, like 6 weeks after, they actually used some traction on the end of the femur. So he said sometimes that'll bother people later on, because they have to put tongs in your femur and then I guess pull on it, put distraction on it so they can do the surgery right. So my knee was very stiff, especially knee flexion. I had to really work on that, but got it back. The hip was just really sore with like adduction, extreme flexion. I would get on my bed on all fours. That was just a great way to work on it, and just do rocking. That really seemed to help me get my mobility back quickly. But active is still, it still hurts me to do a straight leg raise. That's like the last thing I've been able to do is a straight leg raise. Yeah.
How about any sensation loss or swelling, edema?
I had some swelling in my left foot actually afterwards, and kind of down the outside of my leg, but that went away pretty quick. Did not have any sensory loss, no numbness, no evidence of anything like that. Right now my hip abductors are weak. Um, so I assume that's just from pain and disuse. I don't think that's neurological. I don't have any numbness around that area. So, but I do notice that the abductors, the gluteus medius, is still pretty weak, pretty surprisingly weak. So I've still got a problem with that.
Yeah. So you started with a walker. You quickly found that crutches, bilateral or two-sided crutches,
were better
for you, easier in the home to manage.
Yeah, because my walker didn't fit in a lot of my bathrooms. They had really narrow doorways, and the crutches you can just narrow your base of support. So they were just great getting in and out of more narrow environments and stuff. Yeah.
Yeah. And I noticed today you showed up with one crutch.
Yeah.
So now you're kind of to the unilateral aspect, which is
right.
A sign of progression. So how far can you currently walk? What is kind of your stamina or endurance at this point?
I could probably walk about a half a mile. I'd say as much my right hand, just weight bearing on the crutch handle is a limiting. My hand just gets tired from pushing on it for that long. I'd say probably about a half mile is what I've done. I could probably do more than that if I had to, but I think a half mile is probably as far as I've walked so far.
Are you able to walk at all without a device or without your crutch?
Still have a severe limp when I walk without my crutch. So yeah, I do it. I was doing it this weekend some. One thing that's kind of interesting is if I abduct significantly, I actually can walk a little better.
Oh, really? Yeah.
Yeah, with a wide gait.
Kind of
really,
widen your base.
Yeah, widen my base. I can walk a little better. When I'm doing stuff, sometimes I just forget my crutch and I'm like walking around the kitchen. I'll walk unaided then, just convenience. But for anything significant, I grab the old crutch because I walk dramatically better with one crutch than I do without it.
Sure. And so anything into the community, you're going to grab your assistive device.
Yeah, right
for
now.
safety, stability, and also just precautions.
I just get around a lot better, a lot faster,
So tell us a little bit about the exercise that you're going through. What does your daily routine look like right now? I know I've seen you on the bike at times, working on some hip strength, but kind of dive down into your therapy progress at least.
Yeah, I don't know that I've been really, really great at doing my therapy, especially in the last week. But the bike is really helpful, but I haven't ridden it every day, and I probably, if I have time, I should. It does feel really good and does seem to just help in every way. It's comfortable, just really beneficial. I've tried to do, I've walked quite a bit just outside, up and down my street. I've walked up and down stairs, trying to use my left leg a little more, although I haven't been able to really get that do very well, but definitely have tried to do some stairs as exercise. I put a book down and try to do step ups on about a 4-inch platform with my left leg. Still pretty difficult to do, but trying to work on that for unilateral weight bearing and stepping up. Here I've done, I put the TheraBand around my knees and do, like sideward walking against TheraBand resistance. And that feels like it really works those abductors nicely and is a pretty good exercise. I do sideline left hip abduction, and that is actually pretty difficult still. I probably got fair plus strength in my left hip abductor, so I really got to keep working on those. If I shorten the extremity, bend the knee and hip a lot, I can lift it pretty well, but full extended, it's still very difficult. Straight leg raise, I've started to work on that some just because now it's not near as painful as it used to be, so I can do that. I'll put TheraBand in a door and then just do like all the planes of the hip, forward kicks, abduction, backward kicks. And that's pretty easy to do. I've been doing that for a long time. That's pretty much the extent of it. Like I said, I get on all fours. That feels really good. Go into full hip flexion, all fours. Also, I'll lay on my stomach and just do a lot of extreme knee flexion, stretching the quad, because that left quad it gets tight. I think it's just because of the appliance or the hardware that's in there. It really affects the quad a lot.
The quad and the IT band.
Yeah, IT band, particularly IT band. Yeah, in fact, when I get on the bike, I notice if I don't stretch my quad out, my left foot just rotates laterally, and you can just tell it's the IT band just tight as a drum. Yeah, it's real weird. But I think either they went through it or it somehow has affected it to where the IT band has gotten really irritated or tight. That's improved. It was more of a problem a couple weeks ago.
Yeah. And so now you're 7 weeks essentially after your surgery.
Yes, about
Almost
7
to the
weeks.
date, right?
Yeah.
So what tasks remain difficult for you at this current stage in your recovery?
Walking unaided, I would say, would be number one. Going up and down stairs normally is still pretty hard. What else? I've been able to get down on the floor, get on all, both knees. I can come up from prone or supine off the floor, and surprisingly, I can get up. I have to use my hands a lot though. I'll use chairs or objects or the crutch. Like tall kneeling, I can do that, and then come up from tall kneeling to standing. That's last week I've been able to do that, which has been real nice because then I can get down low if I need to. I can crawl, no problem. It feels kind of good too to do that. It's a good exercise.
How about some stuff at home? You're able to cook, take care of yourself,
Yes.
dressing, cleaning, changing your clothes, bathing.
Progressively noted a better ability to work around the kitchen. Washing dishes, I had a lot of trouble doing. I just couldn't stand very long. That's really improved. So I've been able to be in the kitchen longer. I cooked a meal, some soup last night. I think that was maybe the first meal I cooked actually in a long time. I haven't been able to do wash clothes because I can't really carry a clothes basket up and down the steps, and our laundry's in the basement. So my wife's pretty much done that. But I can carry stuff in my left hand, but I just can't do bilateral carry very well right now.
I know you're a big dog walker. You love your dog.
Yeah. I've
have to limit that.
Yeah, limit it. I have tied her to my waist belt or something like that, and then just go along with my crutch now and walk her. So I've still tried to do that some. Yeah, I still get out and do that. We just don't go as far as we usually do. We usually went several miles, and now I only go half a mile or something like that. It's a little shorter. Oh, and one other thing mowing the yard. I can't do that yet. I tried it. I probably could do it on flat because I have to use my crutch on one side, but it was really difficult to do it on a slope. So my son's been helping with that. I haven't really been able to do that very effectively yet. Or weed eating. I can't hold a weed eater with both hands. Anything that's both hands, I can't hardly do still.
Yeah. How about getting in and out of a car? Because I know you've been driving. Tell us a little bit about that.
Yeah, it's not perfect. It takes me a little longer. A lot of times I have to grab my left hip to lift it into the car. But surprisingly, I have manual transmissions with clutches, and I've been able to drive those since 4 weeks, which I've really been happy about because they're my main vehicles that I drive. I've been able to drive those without that much trouble, which has been really good. I found that it didn't hurt much more than walking, so that was fine. It was a little sore, but it was okay. Yeah.
Very good.
Yeah.
What has been the most frustrating aspect of all of this on you physically?
I'm really not in as good a shape, probably. Fitness wise, I'm sure diminished quite a bit. That's probably the biggest thing,
And that would be kind of a secondary impairment of a decreased aerobic capacity.
Yeah, I'm sure it's decreased.
Which is not directly tied to the fracture you had, but it's a secondary impact on the human system.
Yeah, you tend to just be less active when you got something like this. I mean, I really, I'll do something and I'll go sit down for a while. So my, overall endurance is definitely less, and I'm just more apt to take breaks and sit. And so I know I don't have the, I've been deconditioning, I'm sure, compared to my pre-injury state. Yeah.
Yep. What about the most frustrating aspect on you mentally at this point? Now that you're 7 weeks out, you've had some time to kind of reflect back.
Really feeling so good, with a lot of gratitude for improvement. I think, and I'm really just happy to be able to do anything functionally. When you have that much impairment, just being able to do the simplest things just seems really great. So I would say that there's been very little frustration, and I wish I wouldn't have done it. And I think some of the frustration was just that I couldn't help around the house near as much. The things that I like doing and always do. And so that was pretty frustrating just to have, you just hate to ask someone to do stuff for you when you could do it yourself normally. And I think that would be honestly my biggest frustration right there. Other than that, just really happy about improvements, and things I can see improving. It just really is very rewarding to see things improve. That's for sure. You're relieved that you see things improved.
Yeah, we take for granted a lot our independence and being able to be free and do what we need to physically until it's taken away from you. In the
Yeah,
snap of a
that's for
finger.
sure. And how fast, you know, just and you know that old kind of feeling of being invincible. That's when it goes away, when something like this happens to you.
Yeah, I bet.
Yeah.
So now that you're 7 weeks out, you're progressing each and every day, getting better each week. How has your recovery gone? As expected, or maybe not as expected? What are some of the little hiccups you've had along the way?
I went to my doctor today, and you know, they were pleased. The X-ray looked really good. I think I mean, they didn't really say this, but I sort of maybe got the feeling that maybe I wasn't as fast as maybe they expected. I don't know. They looked a little bit at my left leg and quad and stuff, and you know, maybe felt that they asked me if I was doing my PT and that sort of thing. So it made me think that maybe I hadn't been working hard enough. Maybe, I don't know. Yeah, possibly.
Yeah. Any other aspects in your entire recovery that have surprised you?
Not really anything else that I haven't already talked about. You know, I definitely have not recovered maybe as fast as I thought I might. You know, thinking I'm Mr. Invincible and all that stuff. It's been slower than I kind of pictured myself. You know, but that's just me, I think. You know, yeah, my natural. Yeah.
Perfect. Well, appreciate your input here.
Sure.
Now let's get up and take a look at you walk and see
Okay.
how you move.
Yeah. Oh. How do I usually get out? Let's see.
Yeah, where do you want your crutch?
You want me to see? You want to just show me what I do? Now, this is how typically I get up.
Yeah.
You know, I use my like, especially as a problem in low. You know, like a low
chair.
couch or something. But yeah, I just lean forward, always push off with my right, and then just transfer this over because I use this in the right hand. You know.
Mm-hmm. Yeah, just show us how you walk around a little bit.
Okay. You know, I can walk pretty good with my crutch.
Yeah, why don't we go out in the hallway?
Okay. It's not locked up, so not too quick.
Yeah, and then turn around and walk back. It's a little leaning to the side.
Yeah.
Pretty common with an assisted device.
Yeah.
Any pain when you're walking?
Just very, very little. Maybe just a slight soreness, not much.
Just aware of it?
Yeah, just aware. It doesn't feel like zero, you know, like mother hip zero. It does talk to me just a teeny bit when I'm walking.
Yeah.
Not horrible.
And then how are you comfortable going up and down stairs?
Yeah.
Well, let's hit to the
I
stairs.
mean, there's several ways I can do it. I can actually use the railings really well, or I can use it without railings. So, and you know, sometimes it's nice to use both. So like, that's probably the safest, you know. And I've got left hand on a railing.
Mm-hmm. And normally your prior level of function, you'd be going up and down, carrying
Time,
bags,
running,
carrying coffees, and
Yeah, without any
limitation.
Yeah, I mean, I would do stairs as exercise. I'd do like,
Uh-huh.
you know, I'd do like 7 or 8 flights, you know.
Yep.
So going up, you know, I do good foot.
Yep.
Typically that's going up.
Up with the good. Don't even need a handrail
Yeah.
there.
Yeah, I could also do it like this,
Mm-hmm.
and that's real easy actually. You know, a nice solid handrail is really easy. I can try, you know, just a little uncomfortable to use.
Yeah.
I can do it, but
So you're getting there.
yeah, I'm getting there. You know, but it's just that solid railing really helps. Now, if I had my crutch, I'd have a lot harder time
Yeah.
going up with the bad leg.
Mm-hmm.
Yeah.
All right. Yeah. Let's walk back
Then-
into the clinic there.
Do you want to see me walk without assisted
Yeah, we'll do
device?
that in the. Let's start that
Okay.
one in the clinic. Yeah.
All right. Pretty dramatically different. It's amazing how much this helps. I mean, that's what's kind of weird to me.
Yeah. It's an assisted device for a reason.
Yeah, it helps me.
Yeah. All right. Let's take a look at your gait without. Let me get in front of you here
All right.
first. We'll get from before and after. Okay. I want you to walk my direction.
That's without.
Good. And turn the other way. And then can you show us how you get in and off of maybe a bed?
Yeah,
And I
yeah.
know the bed height's not going to be the same as home for you.
Yeah. Typically I don't have as much trouble. Now, let's see. Now I can lift my leg up. Yeah. Now, a couple weeks ago, I would have to.
Yeah, show us how you previously would
A
have
couple
done it.
weeks ago, I would do it like this, and that really helped.
Mm-hmm.
I would lift my right leg. Initially, I couldn't do that. I even would use my crutch and hook the top end on my leg and
Yeah, let me grab
help me get up. And that actually worked pretty well. Or that one loop thing.
The
I was telling
loop,
you
yep,
about.
the foot loop.
Yeah, but you also can go like. Well, I think I did it with my socks on, so
Mm-hmm.
but I would do something like this,
Yep,
and then just lift it up like that.
yep, a little assistance upwards.
Yeah, that actually helped a lot.
Perfect, yeah.
Yeah, but now I'm so much better. I can just.
You get up and down pretty well.
It's been real nice. So we'll do that.